Hello, Enid. I'm Derrick Silas, the Director of Communications for the City of Enid, and today we will get an update from Garfield County Health Department with Ray Johnson, and Maggie Jackson. Welcome to the show, the episode, ladies. Okay, just going to jump right in. Can you give us an update on the number of COVID-19 cases as far as positive, negatives, deaths, and recovered individuals in the Garfield County?
Yeah, so for Garfield, we have 9 positives, 1 death. I can now report that 8 of those are in Enid. For recoveries, we have a recovery number for the state, which is around 1,400, a little over. I think it's 1,441 cases have recovered out of a total of 2,000. Sorry, guys. 2,465 total for the state. As far as recoveries go for the county, we don't have that data yet, but that's something that's coming that we'll be able to share. Recoveries, hospitalizations. So that's coming soon, but we don't have that at this point.
Okay. It's good to know. Okay. So in the April 15th press conference with Governor Stitt, he said, "Our curve is flattening and we are making great progress, but now is not the time to take our foot off the gas." He also stated that the Institute of Health Metrics and Evaluation Model projects that Oklahoma's peak hospital demand will occur on April 30th. When it comes to Garfield County, and have we flattened that peak, or are we behind the peak, or will we be synonymous with what he was mentioning about the state?
Sure. So that model is for this whole state. So it represents 2 large metropolitan cities and other communities who have had cases before we did in Enid. And so we don't know for sure, but we may be behind that curve because we're a more rural area, we're further away, our population isn't as dense as the cities. So that means, we may see our peak happen after the state's peak. But it's still, we'll be watching for it. We don't know for sure what will happen.
Okay. In that same press conference, he mentioned that he announced that the Safer at Home order will be extended through May 6th for adults over the age of 65 and the vulnerable individuals with serious underlying medical conditions. And he said starting April 24th that the elective surgeries could resume. What is your perspective on this as far as Enid residents? Do you believe this will help or lessen the amount of positive cases in Enid or Garfield County?
Yes, I think that it is prudent to continue even into the future taking protective measures for our most vulnerable citizens. It's been tough for people to stay at home, but we think that by keeping our adults over 65 and those with medical conditions, if they can stay protected, then we can start to have life as normal trickle. We can start to ease back into that normal life while still keeping those most vulnerable safe. We know that most cases of COVID-19 are mild for people who are generally healthy. Mm-hmm. So that doesn't mean we just jump back into everything we were doing. We still want to be safe, and we're still looking out for those older adults we live with. We might be neighbors to. We want to still keep isolated from those people.
Okay. If the number of positives rise tremendously, I'll say in Garfield County, is there a plan on another drive-through testing site? And what number, if known, would mitigate such a reason to have another drive-through?
Okay, we felt like our drive-through was a great success, and it was an effort to push out a lot of tests when they had been so limited before. Mm-hmm. Now testing supplies are trickling in, and we're able to maintain appointment-based testing at the Garfield County Health Department, as well as all of our other county health departments in most of the state. At least for our district, we serve an 8-county district. So if you live in Grant County or Major County, Kingfisher County, Blaine County, all of our surrounding neighbors, they're able to have testing as well. So as long as we can maintain those appointments, we'll continue with that way. It keeps our nurses safe. It's still a drive-up system where you stay in your vehicle, but we can do it through the county health department where we have all our supplies. Today, though, Ray and I are on site in Yukon at the Yukon Middle School because our district also includes Canadian County. And so far, we've done 124 tests today.
And growing.
And growing. They had, of course, the bigger population. They've done a few more tests here than we did in Enid. So we did a drive-through here in Yukon because our appointments were getting backed up. We were getting a waiting list of several people. So we needed to do that drive-through push here. So if the same thing happened in Garfield County, we would consider that again. Also, depending on how available supplies are.
Okay. COVID-19 testing is still being done, I imagine, at the Garfield County Health Department. What is the criteria and procedure for someone who wants to get tested?
So there are two different ways. There's a symptom tracker on the Oklahoma State Department of Health website. If you can see my screen, we can show it. So you would go to this public symptom tracker. Mm-hmm. So that's one way, and that's a way to enter in your information, and you would, of course, my computer's not going to work, but you would be able to enter in your information, your symptoms, and you would see if you were eligible for a test. And then it provides a list of testing centers within a 50-mile radius to you. So that's one way to go about. Then you would still have to make an appointment, or you can call the Garfield County Health Department and you will speak to a nurse and they will ask you the same criteria. So 16 and 17-year-olds can be tested with parent consent. 18, and then we're testing anyone 18 and over if they have a cough, a fever over 100.4, or shortness of breath, or known contact to a confirmed case of COVID-19.
And we're also able to test children and adults that have a physician referral. So if a healthcare provider does not have the ability or the supplies to test for COVID-19 at their office, then they can refer them to the county health department.
Okay. You mentioned the COVID-19 symptom tracker, and I know that the State Department of Health partnered with Google and Looker to launch this tracker, and they also did it to do the data dashboard, which is very detailed and comprehensive. Can you tell us more about that effort and its purpose?
So the purpose of the symptom tracker, it's for the public to use to be able to determine if they're eligible and to be able to find those resources to get a test quickly. And then on the other side of it, the state is able to gather information about where hotspots may be, where people may be getting sick, by the information that they provide. And then the just between last night and today, the State Department of Health has totally updated their website, and now you can get a lot of information. It's a lot. So if you like data, feel free to visit this page, and then you'll be able to see, but it does give numbers like for Enid specifically. You can see our recoveries, and this is something that's always changing, but that was part of that partnership that you just discussed.
Also gives more information on the demographics that we're seeing in our state. I know people have had questions about the age groups, maybe the race or ethnicity, and this is, if you like to read data like we do, in your free time, it's a more comprehensive report than we've had before. So it's a good piece of information.
Mm-hmm. And it shares information about hospitalizations, and you can always go to that same executive order report and for more information like that on hospital capacity.
This is also where you can find the information on long-term care facilities. There's been some concerns about our nursing homes, and on this report, it lists cases that might be in a long-term care facility.
Okay. I had a question online, and it was more so that they said that some of the tests, they heard that some tests show negative before later showing positive. Is that a concern? Is that a concern for the 98 that were tested in Enid? I'm not, can you speak to that, whether or not that is the truth concerning that? Is that possible?
It is possible. We've heard a lot of different studies are ongoing still on the amount of false negatives that could happen from COVID-19 testing. We're confident in the execution and the execution of our nursing staff as well as the laboratories. They're testing according to CDC procedure, and there is always the possibility that there could be false negatives and positives, but we don't know for sure. The studies are ongoing, but there's been the labs and the procedures have been validated by other. They're compared against other confirmed positives, so they go through a rigorous process to make sure that the testing results are as accurate as possible.
And some positives are not from that testing event that we did, but the same methods and the same laboratory are being used, and positives have come from that. So
yeah, we can confirm that 2 of the positives that are reported for Garfield County came out of Garfield County Health Department testing. So we know that we're getting positive results out of our testing at the health department. So.
Okay. What are other ways, or you can tell us the ways, you talk about the executive order report online with the OSDH. There are other ways that individuals in the community can stay updated on the county and the state health issues, maybe the phone numbers or the websites or what have you.
Sure. So the Oklahoma State Department of Health website is one that's great. The Garfield County Health Department Facebook page is updated with information specific to the county, and we share information about testing and pretty much anything that we really want to get out to the public quickly. That's a great resource. Also, the CDC website is good for just information about the virus total, and the Enid and Garfield County Emergency Management Facebook page also. Are there any other ones?
We know that the CDC originally had not recommended masks, but now we have our masks on us. We took them off just so we could talk to you all, but keep wearing your masks as long as it's recommended.
One resource we did want to share real quickly is that because so many people are unemployed and it has been going on for a long time, that people may need some extra help, and we are still fully functional with WIC. If you go to the Garfield County Health Department Facebook page, there's a link right there that you can apply online, or you can also apply over the phone, and you can receive all your benefits over the phone. And that's a great resource for women and children, women with children under 5 to get some help during this time.
That helps with supplemental nutrition, education, and food assistance.
Okay. Thank you guys for your update today. Is there any other final words or anything that I may have left out that you may want to talk about?
We are thankful for you sharing information, and we're so thankful for all the medical staff and the first responders that are still working hard and keeping us safe and getting prepared for keeping us healthy down the road.
Okay. Well, we appreciate the weekly updates that you guys do for us. We appreciate it.
Thank you.
Okay. And thank you, Enid, for joining us for another COVID-19 update. We'll be back Monday with an update from the city manager, and we have a couple other updates next week. I think we have a respiratory therapist from St. Mary's Regional Medical Center, and we'll have a representative from CDSA as another guest. I can't remember the other one, but we will be posting those guests on Facebook. Appreciate you for joining us Monday through Friday, 1:30. Remember, we'll be here. Today we were a little late because of the workings of Zoom. However, just join us there at 1:30. We'll be here. Just be back at 1:30. We'll see you then Monday.